And a survey was released in May this year by the International Center for Reproductive Health. In just a few, we will be taking a look at some of the highlights of that survey that was released in May, just about 2 months ago. And then I'll get into a conversation here in studio with Professor Peter Gishangi. He's the lead researcher at the International Center for Reproductive Health, as we just try to break down the numbers and some of the highlights in this particular survey and what it meant. So since 2014, the Performance Monitoring and Accountability 2020 has been tracking trends in contraceptive use and family planning service delivery in Kenya. Kenya is making very positive strides in improving family planning access and use among women. Kenya is one of the countries which signed the Family Planning 2020 commitment to increase married women contraceptive prevalence rate from 46% to 56% by 2015. Let us now take a look at the research data from 2017, according to the Research International Center for Reproductive Health in Kenya. Some of the highlights, of course, quickly, there has been an increasing trend for the demand satisfied by the modern methods of family planning. About 82.7% of wealthy women are more likely to have their demand of family planning satisfied as compared to the poor women, especially those in the rural areas, which where the number stands at about 68%. The rural adolescents and young women on average have sex at 16 years compared to those in the urban areas who start having sex at the age of 18. Quite a disparity there between adolescents in the rural areas and the urban areas. So the rural adolescents and young women start the use of contraception 6 years after they first have sex. That is for the rural adolescents, as compared to their urban counterparts who start using contraceptives 3.5 years after their first sex. Could be issues of accessibility. The professor will be telling us more on that. So implants are the fastest growing family planning method in Kenya, and nearly 15% of all women who are 15 to 49 years old use implants. We'll also be getting an explanation on why implants have become very popular among women between the age of 15 to 49. Among all modern method users, implants account for 33.4% of the method used for family planning. It is the to-go-to family planning method for more women between the age of 15 to 49 across board. And these are just some of the highlights of those statistics. Let's get to the conversation here now with Professor Peter Gishangi, once again, the lead researcher at the International Center for Reproductive Health. Thank you very much for joining us here on KTN News Desk.
Thank you too.
I want us to quickly start with some of the highlights. Let's just quickly do a comparison, because this is a survey you do every year.
Yes.
What are some of the differences from what you have discovered in the results this year as opposed to last year's survey?
Yeah, thank you. Since 2014, that's when we started taking or correcting data for performance monitoring and accountability, which is a way of tracking the performance of the family planning programs in this country. And what we saw in 2014 was that our platform was able to generate data very similar to the gold standard, which is demographic and health survey. And from that point to 2015, we saw an increase in use of modern contraception to about a maximum of about 62%. 2016, 2017, we have seen a slight decrease in use of contraception, modern contraception, from 62 to about 59% in 2017. And we also see a little bit of a decrease in demand for family planning. What is very satisfying is the fact that we see continued increase in demand satisfied by modern contraceptive method. And that is important because modern contraceptive methods are more effective, so they are better protection. So in terms of breakthrough pregnancies, they are fewer. So any woman who is using modern contraception has better protection. And more important is you have seen an increase in wrong-acting reversible contraceptive methods. These are methods like intrauterine device, methods like implants, sterilization, as well as IUDs. So these then protect you for a long period of time. For example, if one was to put intrauterine device, it protects you for up to 12 years. Implant protects you for 5 years or for 3 years. So women who are using this method, they are increasing over time. So meaning they have better protection as opposed to people using short-term methods.
Does it then mean that they are more aware with the number slowly going up, women are more aware of what is effective in terms of the methods to use?
That's true. Women are becoming more aware of what method is reliable for them. But remember that all methods are reliable and they are all effective. It depends on what is suitable for every woman. There are women who do very well on the pill they swallow every day, and they can remember to swallow that pill, and they may be the most suitable method for them. There are others who cannot do that, and they have to do the IUD, or others have to be sterilized by choice. So in terms of awareness, yes, there is increased awareness, but more important is the fact that the methods are available, meaning the commodities are available. You go to a government facility, you find them. You go to a private facility, you find them. And our survey did find that, indeed, more than 80% of the facilities have 3 to 5 methods. That means women have a choice. And that is important, because when you have a choice, then you can be able to choose what is suitable for you. So over time, we have seen that, yes, things are improving. There is great improvement. But the retro decrease we have noted, we have alerted the programming people, the policy people, and actions are being taken, because we need to reverse that trend to continue the trajectory of increase to the point where we want to be. In terms of what you have found with young people, and you highlighted very well, is the fact that young people start sex early in the rural areas and start contraception later. So by the time they're using a contraception, they already have 2 children compared to the urban areas. And this is important because it is a confirmation that indeed our young people are sexually active. So that issue is being taken seriously, because in 2014, 18% of girls aged 15 to 19 years were either mothers or pregnant at that time. And that is an acceptably high number. So from our data, and from using the demographic and health data, now actions are being taken to say, can we reverse this trend? And indeed, our new commitment is to reduce from 18% to 12% by 2020.
What are the issues that you discovered, especially when on statistics to do with young people in urban areas, starting sex and starting to use, they start having sex at 18 years, and then they use contraceptives about 3.5 years after they first have sex, as compared to the rural ones who start early at 16 years and use contraceptives 6 years on. I mean, what explains these disparities?
Part of it is access and education, because the girls in the urban setting have, on average, higher level of education attainment than rural areas. Second element is access. Like I've said, you find that it is much easier in the urban setting to either access commodities from a private chemist or a pharmacy or a private medical facility, as opposed to the rural areas. So indeed, we find that access by itself can influence the use of family planning. And that, we think in most cases, that's what influences the differences between. But education tells you, yes, you're sexually active, and how can you prevent yourself from becoming pregnant? And that's why they start using a little bit earlier than the rural areas. So that then gives them more time for the rural areas to have more children. And that's, again, something we are collectively looking at. How can we change that trend? That indeed, when you become sexually active, as soon as you know you're doing that, the consequence is pregnancy, and how can you prevent yourself from being pregnant?
What about the trend on satisfying family planning needs between wealthier women, which is about 80-something%, to the poorer ones, which is about 68%, I think?
68.9%, 82.7%.
Yes.
The difference, in fact, that shows that there are people in this country, when you look at the national average, we are doing very well. 59% is good as a performance as a country. But there are people who are being left behind. And who is being left behind? The poor people. Because you see 68% by 82% is huge difference. Why that huge difference? It's either the poor people do not have access because of physical or financial barrier, but you also tend to find that poor people are less educated. So awareness among those people is probably less. And there are also other underlying cultural factors which can affect access to the family planning commodities. So indeed, by identifying those factors, then you can institute activities or programs, interventions to reach them. The government of Kenya is very committed to reach all the citizens of this country. And there have been programs proactively taking services to the poor people. Over time, there have been improvement. It is not as good as for the rich people. There have been changes. But all it means is now there are deliberate efforts to make sure that the poor people are reached, either by taking services to them or making sure that they can have access by removing barriers, which may be financial or otherwise. Yes.
So then, does this then mean we need to constantly be having awareness campaigns, especially in the rural areas where the numbers are a bit low in terms of satisfying the need and the number of women who are actually taking up these services?
Yes, constantly there are several ways we can reach the communities. Through media, both audio or radio or television, newspaper. But there's an important kind of people, which you call community health workers, who are among the community. And this can be a very good source of information. But we did find that indeed some people make contacts with the health facilities, staff, but miss the opportunity to be told about family planning methods. So those, again, are areas which we say are low-hanging fruits, which then you can be able to turn around quickly. If every client you see as a healthcare provider, you ask them about family planning, you give them information about family planning, then you are likely to influence somebody. So constant engagement of the population, extremely important, and should be continued through different channels to ensure that everybody knows, and everybody knows the products which are available for them, because sometimes we see products are there, but people are not accessing. Since 2014, when you start doing this survey, what are some of the very significant changes in trend you've seen, and what do we expect to see in the next survey? We have seen a significant growth in usage of modern contraception. Modern contraception is the pills, is the injection, is the IUDs I talked about. Now, traditional method is like abstinence, you abstain from. The others called withdrawal, you can use the rhythm method. Those are not very effective. But they're effective for some people, but not for all. So we have seen that significant growth. A small thing we have noted is a little bit of stock out of products. And again, about between 8 and 10%. And this has been, as soon as we identify such kind of a finding, we share with the government, we share with the counties. At the county level, we have seen all the 11 counties where we are making huge progress. Some counties have doubled their MCPR, modern contraceptive prevalence rate. Others have made small increase. But again, the counties in Kenya are at different stages. There are counties where modern contraceptive use is about 2%. Others about 78%, 80%. So counties with 80%, we do not expect them to grow their CPR. Counties with 2%, we expect huge growth in those areas. And others, so it's a whole spectrum. We call it the S curve, yes. Thank you very much for coming here. We wrap it up on that point. Professor Peter Gishanga is a lead researcher at the International Center for Reproductive Health. Thank you very much for coming in and just breaking down the numbers involved in this particular survey for us. I want us to take a quick break here on KTN News Desk. We still have a lot more lined up for you here, including sports news at 2:30 p.m. Don't go too far.